Welcome back to Carneades.org. Today we're going to be looking at the question, is wealth ethically relevant? Now, the arguments in this video are based on those in our new book, Are All Lives Equal? Why Cost-Benefit Analysis Values Rich Lives More, and How Philosophy Can Fix It. It is now out both in the ebook form and in paperback. Check that out on Amazon. So, economists often tout their discipline as one that studies how societies allocate scarce resources. Yet, economics often takes a normative or moral view of arguing how societies should allocate scarce resources, a question that more rightly belongs to the discipline of philosophy, dealing with issues of ethics and justice. One place where this happens is in deciding how to measure benefits that the societies should try to maximize. In this video, we will look at how the economic model of measuring benefit using willingness to pay is effective for some goods, but becomes problematic for others, as it implicitly requires the assumption that your wealth is an ethically relevant feature of a population. So, specifically, we're going to look at two claims with respect to the relevance of wealth to government decision-making. First, economists currently implicitly consider the wealth of an individual in cost-benefit analysis by explicitly prioritizing the preferences of the wealthy. And two, wealth and income are ethically irrelevant to government decision-making and so should not be included in cost-benefit analysis. Now, the first claim, it's important to understand, this isn't just saying that economists happen to propose policies that happen to benefit the wealthy, and that those policies are good for something else. Rather, what this is saying is that economists are overcounting the benefits that accrue to the wealthy. They are saying that the wealthy actually can feel more happiness and experience more pain than the poor can. They are explicitly counting those benefits more and prioritizing the preferences of the wealthy, giving the wealthy more votes in their system than the poor, explicitly. The second claim says that economists morally should not be doing this. Wealth and income are ethically irrelevant to government decision-making and should not be included in cost-benefit analysis. So essentially, the basic ideas of economics are unethical. A big claim. Let's see if we can prove it. So, to understand this, let's first start with a non-controversial application of economic theory. Imagine that you have 5 identical diamond necklaces that you want to sell. There are hundreds of people that are willing to buy your diamond necklaces. How would you choose who to sell to? You might consider holding an auction, and those that are willing to pay the most for the necklaces get them. This maximizes your profits and ensures the necklaces go to the people with the highest willingness to pay for them. This example doesn't seem particularly problematic, since there does not seem to be an important ethical feature of who gets the necklaces. Those necklaces may have gone to the most wealthy because they are more willing to pay more because they're able to pay more, but that does not seem to matter. If the buyers and sellers are happy to exchange necklaces for money at a certain price, there doesn't seem to be anything philosophy needs to say about the fact that those necklaces went to the wealthier people, or that the market valued the preferences of the wealthy more in this case. A market system seems perfectly efficient for dealing with this kind of a problem. However, now imagine a different scenario. Imagine that instead of necklaces, you have the last 5 shots of a vaccine that will substantially reduce the risk of death in a population. People in the population, though, have different amounts of money that they're willing to pay for those vaccines, driven largely by the fact that they have different amounts of money, period. But also different risk factors to the underlying disease. Some people will die without getting the vaccine. Others will just get a bad cold if they don't get the vaccine. Who should you sell your vaccines to? Those that are willing to pay the most, or those that need it the most, who would be most likely to die? For the economist, this is a similar question to the jewelry. To maximize benefit to society, sell the vaccines to those with the greatest willingness to pay, even if that means more people die. However, for the philosopher, this seems ethically more challenging. It seems that you may be letting people die, and therefore ethically on the hook in some sense for their death, if you sell your vaccine to only the wealthy instead of the vulnerable. It seems that there are ethically relevant factors in the decision, such as the vulnerability to the disease, and wealth isn't one of them. This is further complicated if the question is for a government instead of an individual. Let's imagine that the government has produced these vaccines themselves. Who should the government give those vaccines to? Should it give it to the people that have the most money, even when they don't actually have to pay for the vaccines, or those that have the greatest physical need? It seems that the answer should be to sell the vaccines or give the vaccines to those with the greatest need, even though this would not create the greatest economic benefits as measured by willingness to pay. Remember, measuring something by willingness to pay, check out our video on that if you're curious, isn't about how much people actually have to pay for those things. If people are willing to pay a high amount, according to economics, they receive a huge benefit from receiving that thing, even if they never actually pay. Because the government should not consider wealth when making decisions about who gets public services, it seems the government should be giving the vaccines to those that would die if they didn't get them, not simply those that have more money and therefore are more willing to pay for them. The point here is that wealth shouldn't be an ethically relevant factor that governments take into account when they're deciding who gets to live and who gets to die. Unfortunately, economists already use wealth to make decisions about who gets what public services. The preferences of wealthy individuals are given priority over the preferences of the poor, even before the wealthy spend a dime. This is because economists measure benefit using willingness to pay, and willingness to pay is constrained by ability to pay. You get a benefit if you would be willing to pay for something that you receive for free. And so in terms of government benefits, where you are not paying directly for them, you are getting as much benefit as you have willingness to pay for that. And if you have a lot more money, you would be more willing to pay for things like reducing your risk of death. Check out our book or the videos on willingness to pay and cost-benefit analysis for more on this connection. Now, a clear example that economists take wealth into account when valuing necessities is the central subject of our book, the value of a statistical life. This is the value of mortality risk reduction. In other words, the amount you would be willing to pay to avoid the risk of death, often a very small risk of death. So how much would you be willing to pay for a 1 in 1,000 risk of death, etc. And then they aggregate that up to a single life. When using standard economic measures, governments should value the lives of the wealthy hundreds of times more than the lives of the poor, because the wealthy are more willing to pay for mortality risk reduction because they have the ability to pay more. But when we control for wealth, the differences in these calculations all but disappear. This means that the differences in the economist's calculations are being driven almost entirely by wealth, not by preference. This goes a long way towards proving the claim that economists are explicitly taking wealth into account when they are calculating benefit, when they are calculating how much good you receive. This means that wealth is being taken into account when assessing a very morally relevant topic, whether or not people live or die. The book has a much fuller argument on this and explains the economics that underpin it a lot more. We're not going to get into all of that here in the video, but needless to say, willingness to pay explicitly requires ability to pay, and therefore willingness to pay biases any benefit calculations towards the wealthy. This brings us to the central question of the video. Is wealth an ethically relevant feature of the population that governments should consider when allocating resources? Even if we've shown that economists do in fact use wealth when helping governments to decide who should get what, there could be a question if we think it is ethically okay for a government to say, because you are wealthy, you should have nicer things, because you are poor, you should get less. Should societies give more resources to people that already have more, as economists advocate, because they would be willing to pay for them? Or should other factors like need be considered instead? Let's take a look. So, One way we might dispute the claim that wealth is an ethically relevant feature of the population that governments should consider is through an appeal to Rawls's famous veil of ignorance. Check out our video on the veil of ignorance for more. Rawls asks us to make policy as if we didn't know what race, class, or gender, etc. we would be. Such a group of people might consider questions like individual preferences or vulnerability to a disease as ethically relevant, because they don't know if they would be the kind of person that would have the preference to get a vaccine as soon as it became available, or the preference to maybe wait a little bit and see how it turns out with the rest of the population. They don't know if they're the kind of people who would be vulnerable to the disease or not, and so think that maybe we should take vulnerability into account. But it's hard to see people behind the veil of ignorance thinking that wealth should be used to determine whose preferences are taken into account, since they don't know if they themselves would be wealthy. Another way to defend this claim would be from a utilitarian perspective. People do not have a capacity for greater utility simply because they have more wealth. However, that's what economics implies. Having money does not make you able to feel more pain or pleasure. So using wealth as a feature of cost-benefit analysis that claims to assess total societal benefit is simply inaccurate. When you say that someone has the ability to receive benefit up to the point of their ability to pay, it means that someone with very little ability to pay can have very little willingness to pay for something, and so can receive very little benefit from getting that for free. If I am only able to pay $1 for something, then I am only able to get, in economic terms, $1 of benefit. If I'm able to pay $1 million for that thing, I can get so much more benefit. According to economists, wealthy people just can feel more than all the poor people out there. This seems simply inaccurate, if not unfair. Now, how might the economists respond? A trivial response is to say that wealth should matter, but in the other direction, i.e., we should care about wealth because we should give more to the poor and less to the rich. We should give the preferences of the poor more weight, not less. But such a response, like I said, is trivial. It doesn't actually save the economists that take the opposite view, that the preferences of the rich should be worth more. So while you could make this case to technically dispute the claim that wealth should be ethically relevant, it isn't relevant to disputing the underlying claim of economists that the wealthy should get more while the poor should get less. A more substantive response would be to say that wealth is relevant because there is no salient difference between necessities and non-necessities, between our necklace and our vaccine. Eating healthier food and working out reduce your risk of death, but it seems strange to say that we should give gym memberships to those who are the most out of shape, not those who have the money to pay for them. However, one might respond to this that this is a question of measurement, not policy. And this is really important to understand about this argument as well as the arguments in the book. The book isn't arguing for the socialization of gym memberships or any particular policy. The book is arguing for accurate measurement of benefit. It's arguing that we are doing a bad job of measuring who receives benefit from a particular policy, not saying we should enact or not enact any given policy. We might have many good reasons for thinking we should not socialize gym memberships, while still think that a fresh food market going into a neighborhood of people that have no other options for healthy food has a more substantial benefit to society than putting that same store in a neighborhood where everyone is already healthy, even if that neighborhood is substantially richer. The question here isn't, should the government subsidize that market? Should the government own that market? It isn't any of those policy questions. The question is about measurement. The question is, the government implemented some policy. Maybe it was a tax break for that store, and the store went to the poorer neighborhood that didn't have other options for food. Is that a good thing? Is that a substantially better thing than the store going to a neighborhood where all of those other options exist, but the population is richer? The question isn't about how we get the thing to happen. The question is about how we measure the benefits. Should we ignore the benefits to the poor and overweight the benefits to the rich, or should we control for wealth in our calculations and only actually measure real benefit that's accruing to people? The economists might argue that cost-benefit analyses are not normative tools, and so should not have any ethical considerations attached to them, since they are only meant to advise, not determine policy. However, this is wholly at odds with the reality that cost-benefit analysis is often used to determine if a policy is implemented or not, and it is treated in actual policy as a consequentialist calculus for determining the net benefit of a policy. Either cost-benefit analysis measures something that is ethically relevant to policymakers and therefore is useful in determining whether or not something should be implemented and therefore should conform to the standards of accuracy and morality, or it is not measuring something that is ethically relevant to policymakers and therefore we should stop doing it, period. If it's divorced from real benefit or any considerations of what should or should not be done, there's no reason to use it. If, however, it is trying to capture something real that has at least some relation to how we should act ethically, in terms of a very consequentialist framework of trying to count up all the good and all the bad that a certain policy does, it seems that it does have huge ethical implications. The economists might further argue that such a policy rewards individuals that are responsible with their money and punishes those who save their money and are responsible. It rewards those that are irresponsible because they run out of their money, they have no money left, and it still considers their preferences just as important as those that save money and are very responsible. Now, there's a number of concerns with this, such as inequality is largely driven not by meritocracy, unfortunately, but by family money, as well as several others. But we're not going to cover them all here. We do look at this objection and 5 responses to it in chapter 16 of the book. If you're interested in these kinds of questions and more, you should consider buying the new book, Are All Lives Equal?, out now on Amazon in both ebook form and paperback. What do you think? Should the preferences of the rich matter more than those of the poor? Are there some goods where they should matter more and some goods where they shouldn't? Are there things that we should count as luxuries, like diamond necklaces, where we should care about the preferences of the rich more? And are there other things like saving a life that we should say, you know what, everyone's preferences should matter equally here? Do individuals have a responsibility to provide goods and services to the worst off? If you are the person that has the last 5 vaccines in your town, who do you give those to? Who do you sell them to? Do you sell them to the people that will give you the most money, or do you sell them to the people that are most likely to die? And are you a bad person if you sell them to the people with the most money and let people die? Do governments have a responsibility? Even if you don't, do governments have a responsibility to go above and beyond and to value the needs based on their vulnerability, not based on their wealth? Leave your thoughts in the comments below. Check out the book on Amazon. Subscribe if you like this video and you want to see more. Hit that notification bell. Watch this video and more here at Carneades.org. And stay skeptical, everybody.